Warm welcome to everyone. I am Dr.Deva Priya, Professor in the Department of Periodontics, SRM Dental College, Ramapuram. In this video, we are going to learn about the modified bars brushing technique. So tooth brushing is a routine procedure that is being practiced by every one of us on a day-to-day basis. So the question that obviously comes to our mind is, why should we brush our teeth? Okay, tooth brushing removes the dental plaque that forms on the tooth surface, on the surface of restorations. The plaque forms on the surface of appliances that the patient is wearing and on the surface of the soft tissues. So why should this plaque be removed or eliminated? This plaque is the primary reason for initiation of dental caries, gingivitis, periodontitis, peri-implantitis, and it is playing a role in the pathogenesis of several dental diseases. Okay, so what is the frequency of brushing? According to the American Dental Association, the recommended frequency is toothbrushing has to be done regularly, every day, twice daily, for a minimum of 2 minutes using a soft bristle toothbrush, and the brush has to be replaced every 3 to 4 months. So what are the different brushing techniques that are available? Okay, the brushing technique that has to be recommended to a patient depends on the age of the patient, whether he or she is a child or an adult. Will also depend on whether the patient is wearing any fixed appliances, whether the patient is wearing orthodontic appliances, and will also depend on the health status of the periodontia. So what are the different brushing techniques that have been proposed? We have the Fons technique that is recommended for children, the Leonard's technique, again recommended for children, Bars technique, modified Bars technique, Stillman's technique, modified Stillman's technique, the Charter's technique, which is recommended for patients wearing orthodontic appliances and in patients post-periodontal surgery. Okay, so in today's video, we are going to learn about how to do the modified Bars brushing technique. So this technique is also called as intrasulcular brushing techniques. It is the most commonly recommended technique. It needs good dexterity to be followed, a bit time consuming. The advantage of this technique is that it also allows for gingival stimulation, and there is better efficiency in eliminating the plaque, and there is good interproximal and marginal plaque elimination. So how is this technique done? How do you go about doing a modified Bars brushing technique? First, I will tell the steps using pictures, and then I will show the video demonstration. The head of the brush should be placed first parallel to the occlusal plane of the teeth, and the brushing should start from the distalmost teeth of any one arch, either the maxillary arch or the mandibular arch. And you have to take 2 to 3 teeth at a time. Okay, here we have shown that the upper maxillary arch is taken and the brushing is started from the first quadrant, posterior most teeth. So next will be the bristle. The bristle should be adapted at 45 degrees to the long axis of the tooth. You can see in the second picture that there is a 45 degrees angulation between the bristles of the brush and the long axis of the tooth. So this is the third picture shows the view from the palatal aspect. Okay, so once the bristles are adapted onto the tooth surface at 45 degrees, 10 to 15 short back and forth vibrating strokes should be given, followed by a gentle coronal sweeping motion. Next, once this area, 2 to 3 teeth is done, you go to the next set of 2 to 3 teeth. Again, adapt the bristles at 45 degrees to the long axis of the tooth. Give a gentle pressure so that the bristles move into the sulcus. 10 to 15 short vibrating strokes should be, back and forth strokes should be given, followed by a coronal sweeping motion. In this way, you will complete the entire maxillary arch labial surface, and then you proceed to the maxillary arch palatal surface. Once this is done, you go to the mandibular arch, you finish the buccal surface, and then the lingual surface will be completely done. Once these surfaces are over, next the brush should be taken and the occlusal surfaces of the teeth has to be cleaned. So first, the head of the brush is placed over the occlusal surface. A gentle pressure is given so that the bristles enter into the pits and fissures, and short back and forth vibrating strokes should be given. Next, we move to the anterior teeth. For the upper and the lower anterior teeth palatal surface, the heel of the brush should be adapted onto the palatal surface, and the bristles should be gently pressed onto the palatal surface, and using gentle vertical vibratory strokes in a vertical direction, these surfaces should be clean. In this video, we are going to see how to do the modified bars brushing technique. This technique is also referred to as the sulcular brushing technique or the intrasulcular brushing technique. It is the most commonly recommended brushing technique by the American Dental Association. So when you teach your patients or when you have to do the brushing technique on yourself, there are certain things or steps to be followed. The first thing is you always start brushing from the distalmost teeth of the arch. So you can choose either the maxillary arch or the mandibular arch, and you keep your mouth in the open position. First, place the head of the brush parallel to the occlusal surface of the tooth. Next, tilt the brush so that the bristles are at 45-degree angulation to the long axis of the tooth. So for a better view, I want to show it like this, and this is a palatal view of the 45-degree angulation. Once you have placed it at 45 degrees angulation, you give a gentle pressure so that the bristles enter into the gingival sulcus. Next, you have to give 10 to 15 short back and forth vibratory strokes followed by a coronal sweeping motion. So this process will be proceeded in the front or taken anteriorly to the next set of 2 to 3 teeth. Again, the bristles will be placed at 45 degrees to the long axis of the tooth. A gentle pressure will be given so that the bristles enter into the sulcus, and then 10 to 15 short vibratory strokes back and forth vibratory strokes will be given, followed by a coronal sweeping motion. This process will be taken or continued onto the entire buccal surface of the arch, then continued onto the palatal surface of the arch. Once the maxillary arch is cleaned, you start with the mandibular arch. Again, the head of the brush is placed parallel to the long axis of the occlusal surface of the tooth. Then the bristles are kept at 45 degrees to the long axis of the tooth. Then a gentle pressure is given so that the bristles enter into the gingival sulcus, followed by 10 to 15 short back and forth vibratory strokes with a coronal sweeping motion. So this is continued on to the next 2 to 3 teeth. Again, the bristles are placed at 45 degrees to the long axis of the tooth. Gentle pressure is given, and then 10 to 15 short back and forth vibratory strokes are given with the coronal sweeping motion. Once the facial and the lingual surfaces are completed, the occlusal surfaces have to be cleaned. For cleaning the occlusal surface, the bristles should be pressed into the pits and fissures with gentle pressure, and short back and forth vibratory strokes should be given. Likewise, the entire occlusal surface of both the arches should be cleaned. For cleaning the palatal aspect of the anterior teeth, the brush should be placed vertically. The heel of the brush and the bristle should be adapted onto the palatal surface of the tooth. Then, gentle, short back and forth vibratory strokes should be given in the vertical direction.